From the comfort of your home, you can roll out of bed, log in just as easy as you will to your Amazon account, click a couple buttons, and you'll have a board certified urologist whose only job is to listen to you. I think there's two things that are important for us to do. And the first is awareness of these conditions. And that's why I reached out to you guys, and I love what you're doing, is that you're increasing awareness of, in this sense, men's health issues. And, I'll throw in, obviously I treat female health as well. Because you're right, there is a stigma about erectile dysfunction, about bladder leakage. People just get kidney stones and go, oh, that was painful. And then they don't follow up and do anything to prevent that next stone. People get diagnosed with prostate cancer and are very confused because, frankly, as a urologist, we're confused as to how to treat it. So I think one important thing, and what I'm trying to do with my telemedicine company, Virtue Care, is to increase awareness of these conditions, provide some content from specialists that is high quality, that is in layman's terms, that really breaks down, all right, what are my options? Why is this happening? What can I do about it? I don't just want to go order some Viagra online. Why am I having erectile dysfunction? What does that mean to my health? What can I do about it? And then the second part is breaking down all of those barriers to our traditional, physician-patient relationship. In that now for a patient to see me in person, I have to be in network with their insurance. Their doc has to ask them if they're even having issues, send a referral, hope a fax machine gets looked at, and then a phone call gets returned. And then there's a back and forth of phone calls at inconvenient times. You see me 6 weeks later, and I'm distracted because I've got 30 other patients and I'm full of paperwork and other administrative tasks. Now, for the listeners, that's not your experience, of course, when you come see me, but speaking generally, we've all had that experience with doctors, a distracted doctor who's not paying attention. And for all the pain you just went through, never mind that insurance these days isn't even really covering things. Oh, your deductible's high. You still owe $300 out of pocket for our visit. I'm trying to remove these barriers. I'm trying to make it such that, yes, from the comfort of your home, you can roll out of bed, log in just as easy as you will to your Amazon account, click a couple buttons, and you'll have a board certified urologist whose only job is to listen to you and to get you the answer you need, not to have you fill out all these forms because insurance companies require it. And because there is security, we're using a HIPAA compliant, which is the Privacy Act that came in through the 90s, telemedicine platform. So that no one else is listening to our call. It's just you and I. And we're going to solve your problem, and you don't have to worry about sitting in a waiting room through thin walls and hearing us talk about everyone else's erections or urinary difficulties. So I would argue it's more intimate, it's more secure, and even more private.